voice of people is the voice of God.
This is not a political issue, this is a labor issue, this is a human rights issue.
Welcome to Street Dialogue on 260 Chat with me, Lemwa Rangarra Chekai, and we are here at Africa Unit Square, where nurses and citizens have gathered in solidarity to protest against the move that has been made by the government to fire nurses. And let's hear what the nurses have to say. Murukutichi message yenyu ku hurumende ndeyekutichi.
Message iri yatiri kuendesa kuhurumende ndeyekuti ngavanzwewo chichemo zvedu. We are not any politically affiliated, but we have got our patients at heart.
What's your take on manurses arikunza akaretire vachidzokera pakubasa kana vanga vasina mabasa veve vato apply and vatowana mabasa?
All right, inini being ndine vabereka nditika ndina amaiwo vari kumusha, and I understand kuti kana ivo vakaona zviri fit for someone to retire, it means that person is no longer fit for work. So it becomes very unfair for you to call back that person 10 years later kuti uya ushande. Achakwanisa kushanda sei kana makamboona 10 years ago kuti achakwanisa kushanda nekuti akura. Box rakanzi bring back our nurses and letters to Chiwenga arina kuunzwa nemanesi. Maboxes aya akaiswa nema citizens vari kutoita work behind us in solidarity with us. Vari kutotinzwirawo tsitsi kuti manesi edu we want them to go back to work. So I think they have got a plan kuti pavakambozvironga kuunza maboxes, pavakaronga kuti vanhu vanyore matsamba kuna vice president, I think they've got a way to make those letters be seen by the vice president.
And on a box rakanzi letters to Chiwenga. Achasvikere matsamba dzese dziri kunyorwa dzichiso.
Ndotarisira kuti matsamba aya anosvika. Ndakambonzwa president Mnangagwa vachiti the voice of people is the voice of God. Saka voice revanhu rataura iri kuti tiri kuda kurarama, tiri kuda utano muzvipatara, ndokutaurawo kuri kuita Mwari, and they can't go against that.
Makapiwawo makareceivawo tsamba yekuti basa raperere kana kuti?
For the meantime, hatisati receive yedu, but hatisi kufungidzira kuti zvingaitika saizvozvo because tiri kuedza napatinogona kuti tingachitaura nevakuru vedu kuti vange vachitibatsira panyaya iyoyo.
Imimi sanesi pamauya panapa, what's your message to the government or kuna vachiwenga?
Kuna baba Chiwenga na baba Idi Mnangagwa, isusu tiri vana vavo. Tauya panapa tichiva nekushoshikana nekunetsekana kutiwo zvatiri kuwana hazvichanyatsotigutsa, asi sevana tauya kwavari kuna baba Chiwenga na baba Idi Mnangagwa kuti tinzwe iwo zvichemo zvedu. Ndozvatonyanya kuda kukumbira zvakanyanya, tiri vana vavo, saka ndosaka tiri kuenda kwavari kuti tibatsireiwo tapota.
We feel that the solution to the crisis is not firing the nurses, so that's why I came out today.
All right. What's your message as a citizen of Zimbabwe? What's your message to the government or to the authorities responsible for the situation that we have at the moment?
I think the message to the government is that we need to solve the health crisis, and that won't be done by firing nurses. Government needs to engage nurses and actually hear what their grievances are properly, listen to them properly, and find a solution that allows nurses to go back to work and allows patients to be treated adequately. I think the problem is that for a long time, we have not been allocating adequate resources towards our healthcare system. We have a broken healthcare system, and that needs to change.
How effective do you think this gathering will be to the message that you want to send to the authorities?
So today Zina called this an open air clinic, and the idea was really that nurses would come out to provide whatever medical services they are able to ordinary citizens without the equipment that they normally need. Of course, that's very limited, but it's a show of goodwill from the nurses to show that they do care about patients. They hurt more than anyone the fact that the hospitals are closed, and so to that degree, I think it will build a lot of goodwill among citizens, which I think will be crucial for the success of the strike and for ensuring that nurses get back to their posts as soon as possible.
But don't you think it's already late, since the government is already recruiting new nurses and also bring back those who had gone for retirement.
Yeah. So the problem with what the government is not telling people is that the unemployed nurses and the retired nurses only amount to about 2,000, whereas close to 20,000 nurses have been fired. So the recruitment drive by government will not solve the health crisis. Likely they will put most of the recruited nurses in Parenyatwa because that's the one that will be most in the eye of the press and the public. But it's our rural hospitals and our hospitals in small towns, in growth points that will really suffer and will be affected, because there's no way that those 2,000 newly recruited nurses can replace the 20,000 who have been fired.
For these and other stories, visit our website www.263chat.com. Follow us on Twitter @263chat and like our Facebook page 263chat.